me.
Welcome to the Senior Rehab Podcast.
The podcast for rehab clinicians that want to better serve older adults.
And now, your host, Dustin Jones.
Hello, folks. I hope this finds you doing well. Today's episode is with Mike Eisenhart. He is a physical therapist, a businessman, an entrepreneur, and also the founding member of the APHPT professional community. That is the Academy of Prevention and Health Promotion Therapies. I like to view Mike as a visionary in our field. He has such an amazing perspective to where he can, kind of step away from this traditional healthcare model that we have and be able to ask questions, be able to think differently about how we care for people. And the questions that he often asks leads him to focus on prevention and health promotion, to have an impact on people's lives before they ever even enter the medical system. This is very different thinking, for most of us. We're usually intervening, after disease has become present in someone's life, but he is trying to work, upstream from disease and from any illness. So he has gathered a group of pretty amazing clinicians that are working to develop standards, to develop content, and equip people like you and me to be able to work with people to promote health and to prevent disease. You're really going to enjoy hearing Mike, but I want you to enjoy this conversation, but then stick around for the end. I have a very special announcement about something new that we're going to do in partnership with the Academy of Prevention and Health Promotion Therapy. So without further ado, Mike Eisenhart.
Hello, friends. Welcome to the Senior Rehab Podcast. Excuse the wind and the audio, but I'm out on a run this morning. There's not too many people that I know of that are going to get up at 6:15 during a conference to go out in 30-some degree weather to go on a run, let alone record the conversation. But I do have someone with me that is doing such crazy things. Mike Eisenhart, welcome to the show.
Thank you. Thanks for having me.
Yeah, you're a pretty special dude to get up and do this. This is sacred time for me. Some of the best conversations I've had have been during a run. I call it man time, so welcome to man time.
Nice. I'm feeling good about that.
So, Mike Eisenhart, if someone asks you, what do you do? How in the world do you answer that question?
What do I do? Well, I always start with kind of what I believe and then work it backward from there. So what I believe is movement and health is a window into life. At the end of the day, if we want to all kind of be on the same basic plan, which is work really hard, have enough money at the end to do something with it and enjoy our family and friends, we're not doing that without our health. And so what I do is find all of the latest, best knowledge that I possibly can, distill it down into actionable steps, and give it to people in a reasonable way. I mean, that sounds awfully nebulous, but
not at all.
That's really what it is. It's knowledge transfer.
Yeah.
It's, kind of taking information that's out there and available, curating it, getting it all in one place, tapping the best people who understand this stuff more than I do, and then taking it back to my clients and saying, look, this is how you can leverage it to live a better life.
Yeah. I will say you're the master of rallying the troops, I've noticed. So let's say in New Jersey, in your hometown, what does that look like? Walk us through your day-to-day activities just in your hometown right now with your businesses.
Yeah. So let's see. We have really two primary units, if you can think of it that way. We have sort of a community. So that's our center. We call it base camp. And it's got an outpatient clinic, but it's really sort of looking at a holistic level of the person.
Okay.
So it's literally embedded in the community. We work on health and fitness and nutrition, and still provide traditional physical therapy services. But that's really a smaller part of what we do.
Okay.
And then there is the consulting side, which is really where most of my day-to-day is. And that's working with larger clients, usually at their population level, and coming up with strategies to identify their risks, keep their folks healthy, and move them in the right direction. Or if nothing else, keep them from moving in the wrong direction.
Yeah.
Which is sometimes equally as challenging.
Yeah. So what you're telling me, that you're actually working with people before they get injured or have issues?
Exactly.
How in the world does that happen?
How does it happen from what perspective?
How did you get into that role? What did that journey look like to be able to have that touch point with people or patients?
Yeah.
Or people before they become patients?
Well, I mean, again, it kind of starts with a belief that A, that's possible,
Yeah.
and B, it's worth the effort.
Let's turn around.
So, from a possible perspective, if you really look at it, low risk people who have healthy behaviors typically stay low risk.
Okay.
Now, from a dollars and cents perspective, and I'm, I guess, kind of economical in my thinking that way.
Mm-hmm.
People should want to stay low risk for lots of reasons.
Yeah.
Cost is one of them. And so, kind of seeing it that way prompted me to say, look, there's got to be a better way than waiting for someone to get hurt. So, I don't know, I guess
Yeah.
maybe that's the part that makes me crazy. I just said, well, if there's a better way, we should do it. Like, it doesn't seem like rocket science, but
Right.
it does often, is often met with like, wow, that's very non-traditional.
Yeah. I've mentioned this before to you a couple times, I think, but I got out of school and I was very driven in working with people before they became injured, but it was so frustrated with not figuring out how to do that in the best way, and I kind of got burnt out. But then I worked at a shoe store, and it was an absolutely incredible experience because I felt like I was having as big or a bigger impact working in a running shoe store than I was in my clinic. And then met people like you, Chris Hines, all the people in the Twitter sphere. I'm kind of rejuvenated. So just want to thank you for having this vision, but sharing it, on a platform that people like me can consume it and think about how do I apply it to my population, to my neighborhood, the city where I'm at. So let's transition into the APHPT. So I'm sure some people went like, what in the world is that? Explain that to them.
Yeah, so the APHPT is, I hope, filling a little bit of a gap, as PTs, but really all professions, especially in the healthcare side, we tend to be facing disease, right? Like all of our efforts and all of our energies are really focused. I mean, if we're really willing to be honest with ourselves, they're focused on identifying a disease, fixing it. That's fine. It's really, really good for infectious disease, but it's not good for chronic disease. And that's kind of proven itself out.
Yeah.
Now, everybody knows and buys into the idea of keeping people healthy. Like, I've never met anyone who says, it's preposterous, we shouldn't do it, But on the flip side, not many people know how to actually do it. And so, I mean, it's all different. It's fundamentally different. It's, how you measure things is different. What you look for is different. What you do is different.
Yeah.
Sometimes doing nothing is the best thing, right? So, counteracting the, sort of over-medicalization issue, it's a real issue for us.
Yeah.
So this concept was, well, there's enough people now in our community, the PT community, talking about this, that we really need to start pulling them together.
Yeah.
Now, couple that with the idea that the world is moving at a ridiculously fast rate to this direction. We have to start doing it now. So that's kind of where it's at. I sort of developed this idea of an academy. Let's bring people together who are interested and at some level doing this.
Yeah.
And let's start working toward a standard. Because that kind of speaks to another problem that we have in our profession is we have so many different people doing so many different things, so many different ways, that we have a hard time really kind of defining, who we are, what we do.
Yeah.
And I guess that's, what we're doing here this weekend.
Right. Yeah. So for For listeners, this weekend is the Human Movement Systems Summit in Alexandria, Virginia. That's where we're running, looking at the sun rise in the east. It's a beautiful morning. But yeah, we're having those discussions of identity, of our communication problems, of where can we steer this profession. And Mike is a big player in that, I feel like.
I don't know about that.
So explain kind of the structure of this academy that you've laid out.
Yeah, so I think one of our real challenges is getting outside of ourselves a little bit and being willing to do what we do, but also be vulnerable enough to bring in other professions. So with that, the backdrop of that, there's 3 layers essentially. First are the teams. These are people who want to do it, who want to actually develop the standard.
Yeah.
The advisors, these are people who at some level probably have already done it or are doing it and really are providing an input in what's called the social ecological framework, which is really more of a public health view.
Okay.
And then finally, the networks, what we call liaison networks, which are people who are going to help take this to the world.
Yeah. Beautiful. Yeah, and so I'm a part of the healthy aging team with several other people that the listeners know. And I encourage you to go to aphpt.org. But it's been amazing just to see you have an idea, get after it, and it's not like you're trying to take this idea and make it your own and get in your own way. You literally just get the people in the right place and you say, it's yours, go, get after it, all with that unifying mission and goal, of what you mentioned before. It's just really cool to see from my perspective.
Well,
it's unique, I'll say that. Okay, I'm getting out of breath. Let's stop for a second. I'm going to ask you some listener-generated questions.
Oh, okay.
When you agreed to run with me, I figured I got to get some questions for you and give me a break to stop running.
Yeah, that's good. I'm probably sounding like a freight train right now.
All right.
All the pulmonary therapists are going, diagnosing my breath sound.
He's got some.
He doesn't sound so good.
All right, so first one is from Christina Novak.
Okay.
You know her. The listeners know her as well. She asked, does your fitness evaluation for the wellness side of your clinic change based on age? And do you use outcome measures?
So, great question. So it does. It's always got to be adaptable. I guess I would say our principles never change, right? We know what we want to evaluate in the global sense. We really refer to that as a movement and fitness evaluation. We want to watch people move. We want to understand what they're doing. We want to understand if it's at a high quality or a high, does it look normal? And are they fit? Can they do it, functionally in the world and at what level? So we always measure those basic elements. So it doesn't really change in that sense. But obviously the selection of tests and measures to get to those need to change because, we're not going to typically take a 4-year-old and ask them to, push press over their head and say, well, we want to measure your strength, so, let's load up the bar,
Right.
Obviously, we got to change that.
Yeah.
So it's hopefully developmentally appropriate based on lifespan.
Yeah.
Yeah. As far as outcomes, I have never seen an outcome tool, a standardized outcome tool that covers everything. So we often piece things together.
Yeah.
And that's really at the individual level. At the population level, we always do pre-post test at some level, whether that be kind of, health risk assessment level stuff or something else.
Okay, awesome. Yeah. Chris Hines, our buddy Chris from that state up
all
north.
The people with the really good questions. We got all the smart people.
I'm catching you off guard here. Yeah, Mike has not heard these questions, so this is he's handling it well. Chris Hines asks, what key resources would you recommend, books, articles, etc., to help better inform PTs in managing population health?
Well, I don't know of any. I'm sure there's like a bank of public health literature. To me, it always starts with the data. I think at the heart of population health, that's what it really is. It's defining data elements, letting the data tell you a story, and then being much more precise with your interventions based on what it tells you. So I think in that regard, I would I guess I would put people toward the idea of saying, look, get really comfortable with Excel spreadsheets. As boring as that is, the math behind it is often what gives us the story.
Yeah.
But as far as like actual books, I don't know. I guess almost everything that I do has been, journal articles. A lot of it is done in, circulatory type disorders, heart disorders, heart disease, because we have these huge data sets. And so, things like the NHANES data set and those kinds of things, I would just scour the epidemiological data and just understand the language. That would be the first thing to start with.
All right. And I'll try and remember to put a link in the show notes for any of those studies that stuck out to you.
And that's just as an aside, that is our first project at APHPT, is the group is starting to convene and compile those studies.
Yeah.
So the people who decide to be members and get involved will have access to that.
Awesome. Chris Hines again. He asked 3 questions, so he was very interested to hear your answers. So he says, Tim Ferriss style, what does the first hour of your day look like? What do you have for breakfast? What are your morning routines other than getting up at 6:15 and running with someone you just met?
Yeah.
Other than that, what's a normal morning look like?
So I always find strangers to run with. No, so I'm typically a pretty early riser. Having worked in these construction industry for a while as a consultant, they start their days pretty early. So I'm usually up, 5 o'clock or earlier. Most of the day, the first thing I reach for, depending on how busy the West Coast was on Twitter the night before.
Damn Jerry Durham. Gosh.
I wasn't going to call anybody out in particular, but there are a couple. So usually a cup of black coffee. That's something that is a ritual for me. As far as my breakfast, I don't really have a set routine. I have this thing in my house. It's an awesome thing. My wife will not think this is funny, but we call it the lunchbox genie. I leave my empty lunchbox on the table, and then when I wake up in the morning, it's full. And so what you get with that is you never ever argue with the lunchbox genie, because otherwise, she doesn't show up anymore. So it's like the tooth fairy. You never ever ever argue. So whatever's in there, I eat.
You take it.
Yeah. So I don't typically have a sit down breakfast. Usually I say hello to my kids and give them a kiss and get out the door.
Yeah. Okay. Chris Hines also asked, what can clinicians do today to start impacting population health in their workplaces, their schools, and their communities?
So by far the most important thing they can do is what we're doing right now, right? Live it. I mean, that's it. Like when you live health, when you start to get involved in your own health and start to understand those metrics, right, that quantified self, when you understand what you're looking at, it's much easier to talk about it. You've been there, you've done that, you have the stories.
Yeah.
And it becomes, you sort of start to find that community. So do it. I mean, that's the first thing. After that, of course, there's a whole lot of more science, ways to do it better.
Yeah.
But I'll take do it over, waiting to make it perfect any day.
Yeah, that's a good point. All right, last question from your boy, Jerry Durham. He says, in the future, what is the PT's expertise? And then he did a kaboom at the end.
I leave it to him to give you the stumper.
Exactly.
So, I mean, our expertise, I think, really has to be health assets, right? I mean, like that there's even, I forwarded it to my team, there's a call right now for a new professional. And I kind of laughed at it, but also I think we should take it seriously. Where this group of whoever, I don't know if they're clinicians or researchers, wrote a paper and essentially said, listen, we need a new professional. We need someone who understands this stuff and deals only in this stuff. I think PT should fill that void. I think that there isn't a clinical health asset manager. That's really what it is.
Yeah.
Understanding the roots of lifestyle disease, non-communicable disease, if you prefer that term, and knowing how to get after it. And that's pre-diagnosis, pre-label.
Yeah.
Because I really do think that when you look at the literature, almost all of the diseases are the same end result of common roots.
Yeah.
So it's like, let's treat the roots. So,
Right.
I don't know.
That's a good point. And you're definitely, working towards making that happen with the APHPT, with, your involvement here, which, this summit is very related to all the things that you've been doing. So just want to encourage you to keep after it. I know you got a lot of people cheering for you and wanting to do whatever they can. So if people do want to ask you questions or ask, how can they get involved in this and make this a reality for our profession, how could they get a hold of you? You're a Twitter guy, so
For sure.
Do you remember your handle off the top of your head?
Yeah, it's pretty complex. Mike Eisenhart.
Okay, how do you spell your last name?
That's Eisenhart.
Okay, and then APHPT.org is the website, and I'll put a link to all those in the show notes. So thank you all for putting up with the windy conditions and us panting and breathing into the mic. But this is fun.
Right,
Mike,
thanks, man. I appreciate it. Yeah.
All right.
All right, folks, there you have it. Mike Eisenhart with the Academy of Prevention and Health Promotion Therapies. So the big announcement that I mentioned at the beginning of the episode, we are bringing on APHPT to the Senior Rehab Project Network. So Jason Robinson and Deanne Jewell are going to be co-hosting a podcast that is specifically focused on prevention and health promotion therapies. We want this to be kind of the go-to resource for people like us, the rehab clinicians that work, with all kinds of different people, but to help equip us to be able to interact with people and serve them in a way that's going to promote health way before disease even comes into the question, or help them even after they've been given a certain type of diagnosis. So I'm really excited about this. So you can find out more at seniorrehabproject.com, where you'll find a link to their podcast and also links to the Academy's website, which is aphpt.org. But just go ahead, look in the show notes. There's going to be the links for this podcast. We're also doing kind of a live interactive video session that I'm really excited about, and I know you're going to enjoy as well. So once again, go to seniorrehabproject.com to find the links to that. So thank you for listening. I appreciate you. And until next time, do not forget to stay funky.